We're going to talk to Professor Peter Martin, who is the director of the Vanderbilt Addiction Center. He's also professor of Psychiatry and Pharmacology at the same university. Welcome to WFID, Professor Martin.
Delighted to be here.
We have just received message about what probably could be regarded as groundbreaking research on cannabis and exercise. Could you please tell us what this research is all about?
Well, this research is directed towards individuals who are addicted to cannabis. They are so-called cannabis dependent, using the diagnostic criteria of the American Psychiatric Association. And these individuals were recruited because they were not particularly interested in seeking treatment. They were recruited for a study in which an exercise program of 2 weeks duration was crafted for them, and based on their level of fitness. We tried to get them to exercise for 2 weeks, 5 times a week, for a period of an hour or so, including the warm-up and the stretching and those kinds of things, at a rate which would increase their heart rate to 60 to 70% of their maximal heart rate. Mm-hmm. And these individuals, as I said, had no interest in stopping smoking cannabis, but what we did is we carefully interviewed them prior to the study, during the study, and for 2 weeks after the study to ask them how much cannabis they were actually consuming, either by smoking or other means. And we were able to demonstrate that during this very relatively short exercise period of 2 weeks, there was a 50% reduction in their cannabis use. But what was so interesting to me is that not only did they show a reduction in their cannabis use, their craving for cannabis was also reduced.
That's interesting.
We tested their craving using subjective craving score. It's a questionnaire where which they took after they were shown pictures of cannabis use or cannabis paraphernalia or anything related to cannabis, and they ranked their craving. It's a technique called cue-induced craving. And the idea is that when a person is addicted to a drug, when they see pictures of that drug, their desire for using the drug spontaneously increases. And these individuals not only had a significant reduction in their use of cannabis, the craving for cannabis after seeing pictures of cannabis also substantially diminished. Mm. Now, this suggests that in fact, perhaps the basis for the reduction was a resetting of their brain, such that their desire for the drug was diminished.
Hmm. Now, this went on for, if I have understood it correctly, for 10 sessions for 2 weeks, was it?
Yes, it was.
Yeah.
So Monday to Friday, basically, Monday to Friday for 2 weeks.
So have you done any follow-up after a longer period of time have elapsed after their exercise sessions?
Well, we followed them for about 2 weeks thereafter, and there was a slow tendency for their cannabis use to increase, although it never quite reached the level that they were using before the exercise. We would predict that over time it would return to normal levels, unless they continued the exercise.
And what were their own perceptions of this? Were they astonished or?
Well, I don't think it was a matter. We did not study that. We were astonished.
Yeah.
They were people who were not at all approached with the purpose of we're going to change your cannabis use at all. So we didn't question them about that, because that would interfere with the experiment. But we were quite astonished to see such a large reduction in people who really liked cannabis and wanted to smoke as much as they wanted to.
So what will be the consequences of this research? Are you going to continue it and develop it, or what is going to happen after this obviously very successful findings?
Well, as you rightly point out, this is a very preliminary and early study. And I think that what begs to be done is to conduct a randomized, controlled clinical trial in which patients, in which the efficacy of exercise is compared in much larger numbers in a double-blind manner. Mm-hmm. And by that we mean that patients will have no knowledge of what the treatment is. So, for example, exercise versus control. Mm-hmm. And that's going to be difficult to do, but we're in the process of planning that. And we certainly need much larger numbers, and we need a longer period of time. So this is an indication that there may be something very important in this, but it clearly needs to be replicated by others, as well as done in a more meticulous way. And also, the most interesting perspective for me as a scientist is what is the mechanism that this works. And, my speculation at this stage is that exercise modifies brain pathways that are responsible for interacting with the environment such that a person has craving for a drug. And I think we're in the process of developing studies to look at brain activation, mapping, to determine exactly how exercise does this.
Do you think this would be specific just for cannabis, or could it be implemented when we talk about other drugs as well?
Well, I think that we do have reasonable data right now for something like smoking of cigarettes, that exercise does reduce that. But this is the first time that anyone has demonstrated the efficacy of exercise for smoking cannabis. The reason I say this is that we know, for example, that exercise can reduce cigarette smoking, but if you add cannabis to the tobacco, it is more difficult for cigarette smokers who have cannabis added to their tobacco to quit smoking those cigarettes. Cannabis is highly dependency-causing, and so it modifies somewhat the addictive potential of nicotine or of tobacco. So the idea is that cigarettes that have nicotine in them and that have tobacco in them, and cigarettes that have cannabis in them, marijuana in them, are not the same by any means in terms of the way the addictive processes in the brain go on. There are similarities, but there are also differences. And so, the fact that it works for cannabis is really quite novel at this stage. There are some studies that have been done, for example, with alcohol and exercise, and those show some positive effects as well. So I think, personally, my perspective on exercise is it's generally a very good thing for health. And I think that it has been shown to be beneficial in a variety of things, from cognition and prevention of brain deterioration or basically related to neurodegeneration, related to Alzheimer's disease and those kinds of things. Those have been demonstrated. Those kinds of studies have shown the benefit of exercise. There have been studies showing the benefits of exercise for mood and other psychiatric illnesses. So it's a very good thing to do, to exercise. But I think there is a unique, the cannabis area is extremely interesting because of the strong association between the cannabinoid system, the endocannabinoid system, and appetite for food. Mm-hmm. And I think that the sorts of work that we are planning to do will have a tremendous implication, not only for cannabis dependence, but for the rest of medicine, including obesity and overeating.
Well, of course, if we look at in the long term, this could save, if it works on a larger scale, it could save an enormous amount of money. Considering treatment and everything, because if people can exercise and get rid of their addiction and craving, of course, that is healthy, and it's financially defendable as well.
Yes, I certainly agree with you, but I tend to look at more the perspective that it is good for health, and it is good for the well-being of the person, much better than using drugs and separating yourself from life. This is something that can make you more healthy and become involved in life.
Well, this is most interesting, and I hope that we might be able to get back to you when you have developed this research and maybe are working on it on an even larger scale than has been the case up till now.
Well, I look forward to keeping in touch. I do appreciate the fact that the people from across the ocean have become interested in our work. That's very exciting to me.
Well, thank you for taking the time to talk to us.